I'd like to thank everyone for joining our Implementation Research Group Cyber Seminar today. My name is Christine Kowalski, and I'm an implementation scientist that leads the Implementation Research Group. And this IRG is a learning collaborative. We're set up to share best practices and lessons learned in implementation science. And as a group, we're always working towards advancing the field of implementation science. We have over 500 members, and the session today is part of our monthly catalog of events. If you happen to join the session today and you're not part of this collaborative, but you're interested in joining, you can send an email to irg@va.gov and just let us know you'd like to join. I'd like to thank our presenter for her work in preparing for this session today. We are so pleased and grateful to have Dr. Sarah Birkin presenting for us today. Dr. Birkin is an associate professor in the Department of Implementation Science for the School of Medicine and a member of Wake Forest Baptist Health's Comprehensive Cancer Center. Her research focuses on organizational determinants of implementation, middle managers' role in implementing evidence-based practices, the implementation of innovations in cancer care, and the selection and application of implementation theories, which she'll be speaking about today. She also co-hosts a podcast about women in academia that's called Acadame, so feel free to check that out. And just as kind of an intro to the session, as you probably know, models, theories, and frameworks have goals of generalizing implementation efforts and findings across settings and across different clinical conditions. But despite their benefits, evidence suggests that they're seldom used and often used suboptimally, which obviously limits their benefits. So with the number available, it can be really challenging to choose a model or theory. And in this talk today, Dr. Birkin will offer guidance for when and what purpose these theories, models, and frameworks may be most useful. And she will review types and characteristics and then map them onto phases of implementation research and practice. So we hope that you all enjoy the session today. And now I'm going to turn things over to Dr. Birkin.
Sarah, you are muted right now.
Okay, thank you so much. Can you hear me now?
We can hear you now, thank you.
Good, okay. So thank you so much for the invitation. I'm really excited to be here and grateful for the invitation and excited for the opportunity to talk about this topic, which I'm really invested in, and this is a work in progress. This is an area of my research that continues to undergo development, so I really look forward to everybody's thoughts on what you hear and how I can improve it in different directions I can push it in. And so I'll start by telling you that this research area for me, this area of scholarship, comes from a deep, deep place of humility because it was inspired by having to rewrite my doctoral comprehensive exams. So my training is in organizational sociology. That is the concentration area of health services research I was trained in. And my assignment on my comprehensive exam for the organizational sociology concentration was to identify and apply a theory to conceptualize a research question that I had about middle managers' role in implementation. And I choked. I did not do a good job. And it was really upsetting to me. I had taken so many classes in theory. I took classes in sociology and in the business school and within the School of Public Health. I'm pretty well versed in theory, and I was very upset not to be able to select and apply a theory competently. But in the months and years that followed, I was able to comfort myself with the knowledge that even though I had knowledge of a lot of theories, models, and frameworks, I was never trained on how to select one or apply one. I just knew a lot about them. So it was no wonder that I wasn't able to do so for my dissertation research. And I find that there are a lot of really established researchers who are in the same boat that I was. So it's become a passion of mine to help people select and apply theory. So I want to preface this work with some work that my colleague Per Nielsen has done. He's at Linköping University in Sweden, and he wrote a paper that I'll reference in just a moment about theories, models, and frameworks in implementation science. But what I want to do to begin is, in case there's anybody who is a little bit on the fence about, why is this really important? Because I think I talk to a lot of people who maybe are interested in selecting and applying theory because they know they have to for a grant application or for a paper or for their dissertation or what have you. They're not necessarily inherently interested in the potential benefits of theories, models, and frameworks. And you'll hear me sometimes by accident refer to theories, models, and frameworks as theories for shorthand, but just know that unless I specify, when I say theory, I actually mean all three. And I'll talk more about what those are in just a minute. But I want to talk about, theories in particular. This time I actually mean theories alone. They identify causal mechanisms. So a lot of people come to implementation science with an idea for an intervention that they're having some trouble getting people to use. That's great. And there's oftentimes some problems with their implementation, and people want to get into implementation science so that they can improve the use of their intervention that they think is going to improve care. That's great. But unless we understand the mechanisms driving those interventions' effect on outcomes that we're seeking, we can't replicate them. We can't replicate their benefits in other settings, for example, and we can't understand why and how they work. So oftentimes I encounter people who say, it's really window dressing, to have a theory, model, or a framework. And I see, superficial application of theory that reflects this all the time. Everybody has a theory, whether you are explicit about it or not. There are people who will kind of say that they don't really need a theory. They know how it works, whatever. But we are scientists. You would never submit a grant application without explicit methods about how you were going to do something, or a manuscript where you described your methods in detail. It's like submitting a quantitative grant application without a power analysis. You need to make your assumptions explicit, and that is what a theory, model, or framework does. It also helps us accumulate knowledge over time and generalize beyond contexts and interventions to develop an integrated body of knowledge. So, okay, Kurt Lewin said there's nothing so practical as a good theory. Hopefully you agree, and this preface was unnecessary. But then there's this question of, okay, which one do we choose? Because there are so many. So the paper I said that I'd talk about of pairs is this, it's cited down below on the lower left-hand side of this slide, where he presents a taxonomy of implementation science theories, models, and frameworks. So a quick kind of definition of these three different things that I've been talking about pretty informally so far. Theories predict. They explain causal mechanisms, whereas models just describe often the process, whereas frameworks just kind of identify. You can think of theories as distinct from models and frameworks in the sense that theories propose relationships among included constructs, whereas models and frameworks in particular are more like lists or menus of constructs with no proposed explanation of the causal mechanisms underlying relationships between constructs. So I know this slide is overwhelming, so don't worry quite yet. I'm going to use animation. I'm going to use some marking up just to kind of help you walk through this because I know it's overwhelming. But I do encourage you to read Per Nielsen's 2015 paper in implementation science to give you a sense of what's out there. There are also some really good papers by Rachel Tabak and some other papers out there that may be really helpful in orienting you to all that are available. But you will end up with a question that hopefully I'll start to answer in this presentation of, okay, well, how do I choose? So process models are up here. Let's see if I can do this. Well, maybe I need to use a pen or something, or maybe I'll forego it. Pen tool. Okay, we're here. We're process models. These are, just describing and guiding the process. I think of implementation practitioners using process models. Like, how do we think implementation is going to go? And as I'll describe in just a moment, it's kind of a prospective sort of tool in many cases. And then over here, you have evaluation frameworks, which I think is retrospective. So like, how did implementation go? I think of, process models as things like precede, proceed model, and evaluation frameworks as things like REAIM, the reach, effectiveness, adoption, implementation, maintenance model, to kind of like, how did implementation go? Now, down here, we have determinant frameworks, classic theories, and implementation theories. And these identify determinants of implementation. These, I would argue, can be used both retrospectively and prospectively. My work typically looks at these things retrospectively to say, what influenced implementation? So a very widely used implementation determinant framework is the CFR, the Consolidated Framework for Implementation Research. This is, many people I'm sure are familiar with it on this call, really meant to be a broad brush to understand potential determinants of implementation, largely but not exclusively at the collective level. There's also the theoretical domains framework, which I would argue is largely at the individual level. So thinking about, among providers, for example, what is driving their approach to implementation. There are also theories, so not just lists, but proposing relationships among included variables. So a lot of my work ends up being about organization theory. So things like institutional theory, resource dependency theory, contingency theory, and I'm working on a project called Organization Theory for Implementation Science. We affectionately call it OTIS, and I won't talk about that here, but there are these classic theories that Pear talks about that can help us conceptualize adoption decisions or implementation. And then there are a few theories out there that are specific to implementation. Klein and Sora, Brian Weiner has pulled from the field of manufacturing, the theory of innovation implementation. So these can be really useful. There are a lot of these theories that can be very useful. So this is good. We kind of know it's available. That's great. But how do we choose among them? And so this is where I'll kind of get into hopefully some guidance associated with that, although bear with me because it is under development. This slide does have animation in other platforms, not here, so this is a lot, and I will walk you through it. So sit back and relax, and I'll walk you through it right to left. So hopefully you'll recognize over here Enola Proctor's implementation outcomes paper figure, where, she's talking primarily about implementation outcomes like acceptability, sustainability, that sort of thing. And she's introducing them with respect to other outcomes that are commonly assessed in health services research, social work, so on and so forth. So there are, we're oftentimes seeking to improve function, satisfaction, morbidity, mortality, and that's our goal. That tends to be our goal. We're trying to improve patient outcomes. And oftentimes, we're coming at that goal having recognized that there's some problem with service, right? Care is inequitable, it's not timely, it's not effective, it's not safe. And so a lot of us come to this field thinking about some solution to the problem. We have something that is going to improve care effectiveness or patient-centeredness or efficiency or safety or what have you in an effort to improve morbidity, mortality, satisfaction. And we realize we've got this great solution, we've got this intervention that we've developed or we've identified that's not used in practice, and that's the problem, right? That it's not used enough. And we know there are all sorts of interventions out there that should be used in practice and aren't, and that's really the motivating force behind implementation science. And so here's a little pet peeve of mine. Even the National Institutes of Health defines implementation as the study of strategies to facilitate the translation of evidence into practice. And so a lot of work has been done here in implementation science. And, you know, just focusing on external facilitation or, you know, engaging different groups or financing strategies, so on and so forth. And I'll talk a little bit about that pet peeve I have in a moment and what the issue I take with that in just a moment. But my question is, how do we select implementation strategies? And what does all this have to do with implementation science, theories, models, and frameworks? Well, I promise to tell you. Oftentimes, we jump right to strategies. We have some problem getting people to use the intervention that we have in mind, that we've developed, that we're interested in testing, and this is our focus, is just trying to shoehorn that intervention into practice. And we, as a reviewer of papers and grants, I can tell you, I see the way people select those strategies is incredibly idiosyncratic. Oftentimes, it is just what their team is good at, external facilitation, for example. There are lots of other strategies, audit and feedback. We're experts in audit and feedback. The problem with that is that if those strategies do not target determinants of implementation of that intervention, in that context, it will not work. The strategy will not work. Oftentimes what I see is people don't even look at determinants of the problem. They just jump right to strategies. So they don't even know if the strategies that they have identified are going to address the implementation problem at hand. So, you know, I'm going to take a step back and guide you through how theories, models, and frameworks can help us do better with respect to what I think is often our goal in implementation science. So it's not always as linear as I'm about to talk about, but hopefully you can identify kind of your piece of this puzzle or this process and think about how you can draw in theories, models, and frameworks in this process. So oftentimes we identify some sort of problem. So I'm actually working with some VA investigators, Rich Matulovich and Ram Pasek are two of many investigators I'm working with to identify determinants of the continued use of CT for low-risk microscopic hematuria. This is based on a nice body of work that is developed that has determined that using CT as an evaluation strategy for low-risk microscopic hematuria actually does more harm than good. This is a well-documented problem. So other people have done the lovely work of identifying what the problem is. And as implementation scientists, this, for us, oftentimes this work has already been done of identifying the problem. But here's the issue, is, again, a little bit of a bugaboo of mine, is that we haven't done the work to identify determinants of the problem. And I will say that a big potential contributor to the problem of not being able to look at determinants is that it's not well-funded work. We are in a funding climate where we really like trials. We really want to test strategies. And we don't have as much of an appetite for assessing determinants of the implementation problem that might point us in the direction of selecting targeted strategies that will actually address the implementation problem. So how do we identify determinants of the problem? I would argue the best way to do this is to get a broad scope of potential determinants, looking at the whole forest, looking at the amalgam of potential determinants and how they work together. So my colleagues and I advocated for the combined use of the Consolidated Framework for Implementation Research, or the CFR, and the Theoretical Domains Framework, or the TDF. The reason we do this is because we argue that it helps to identify multi-level determinants of implementation. So you'll see, in this figure on the right, it doesn't encapsulate the theoretical domains framework. On the left side of, where it says outer setting, that is really representing the Consolidated Framework for Implementation Research. Laura Damschroeder has talked about conceptualizing the theoretical domains framework, which really lies at the individual level for the most part, as blowing up that upper right-hand quadrant of the individual and team characteristics. And I would very much agree with that. So, but really the point is that you can use any framework list of potential determinants of implementation to start to think about what's going on here. Why isn't this thing, this intervention, being used in practice the way we want it to be? And so I'll give you one example of how I've done this in previous research. A lot of my empirical work has been on the use of cancer survivorship care plans. And so my colleagues and I did this study. It was an interview study where we asked healthcare professionals about potential determinants of their use of survivorship care plans. And we used the theoretical domains framework alone. But again, this kind of gave us a very broad perspective on potential determinants to kind of get a sense of what is potentially happening, potential determinants of the implementation of, in this case, survivorship care plans. So that's useful, right? So in that study, for example, we were able to identify these factors in red. These aren't actually the factors. I'm just giving you the example. But, you kind of get a sense of what's happening and the kind of combination of factors that are driving the use of survivorship care plans, for example. Providers have concerns about reimbursement. The time they're spending putting together these care plans isn't reimbursed. But they know they have to do it because the Commission on Cancer is requiring the use of survivorship care plans for the purposes of accreditation. There are patient flow issues, like how are we going to get these patients in? These represent trees in the forest. And these trees, I'm going to lose this analogy really quickly, so just bear with me. We need very specific tools to address the unique dimensions of these factors that are influencing implementation. So if we know, for example, that people are not using survivorship care plans because they're not expected to use them by leadership, or because they don't know how to use them, there is no amount of education, or, well, education probably isn't a good example there, but external facilitation that could address that. Or if this is probably a better example, if reimbursement is the most salient issue, they're not getting paid to do it, there's no amount of education that is going to address that problem. And if we don't even know what the problems are, we sure as heck are not going to be able to address them with idiosyncratically selected strategies. So how do we kind of figure out what is going to influence these particular factors? We need strategies that are theory-informed, that are conceptually believed to influence and address determinants of implementation. So I think the link that I put in here is probably the behavior change wheel, and I'll talk about this a little bit more in just a moment. But the behavior change wheel is an extension of the theoretical domains framework, and it helps map these determinants onto strategies that are theoretically understood and in some cases empirically backed approaches to addressing determinants of the problem. At collective levels, if there are organization level determinants of implementation, as there often are, things like implementation climate, which we know is really a kind of organization level, a collective level phenomenon, then we need organization theories. These to date have been pretty inaccessible, unfortunately. So my colleagues and I, as I've mentioned, in the Otis project, Organization Theory for Implementation Science, which we're getting really close to finishing, I'm excited, we're working to consolidate those into a framework for easier use than is currently possible. So things like the behavior change wheel are really useful. Also, implementation mapping is another really wonderful approach to saying, okay, what are the determinants of implementation and what are the theoretic strategies that can address those determinants head on? So we know that our approach, the implementation strategies that we use are going to target them, and it uses theory to do that work. I'd also draw your attention to the Center for Implementation. Julia Moore is the director of that center and really does a nice job of walking through in her coursework how to address determinants of implementation with strategies. And then, of course, we get into what I would say, unfortunately, is the bulk of what is funded in implementation science to date, which is testing strategies. But I hope I've convinced you that this is just the tip of the iceberg, and there's so much more foundational work that has to be done in implementation science if we are actually going to identify effective strategies to begin with. So I'm going to introduce a tool that I feel, proud of, but also like it's not quite the end-all be-all by any stretch. And it is the theory comparison and selection tool. In an ideal world, in my mind, what we would end up with would be some kind of algorithm where you could kind of put in the things that you need out of a theory or a model or a framework, and a computer would spit out the ideal theory, model, or framework. There is something close to that that you can find at dissemination-implementation.org. It's a website that was developed by Borshika Rabin and Rachel Tabak and their colleagues, and it's wonderful. But it is really difficult to develop an algorithm, a computer algorithm that is going to produce an appropriate theory for you. So far, we're left with our imperfect human brains to identify potential theories, models, and frameworks. So I think the TCAST tool, which I'll talk about now, is a step in the right direction that can be used to complement websites like disseminationimplementation.org. What TCAST does is it helps investigators assess and evaluate the relevance of the theory, model, or framework or multiple theories, models, and frameworks that they might be considering to frame their work. Primarily, I would say that this tool should be used to justify the selection of a theory, model, or framework, because so often, as I'll talk about in just a moment, we find the very idiosyncratic selection of theory, and it can be pretty superficial and more like a checkbox than anything else, which is unfortunate. Because as I like to say, theories, models, and frameworks should not be an albatross around your neck. They shouldn't weigh you down. They should give you wings. And I'll talk about in the next part of the talk in just a moment about how you can do that and really make theories, models, and frameworks work for you. But I'll tell you, you can find the TCAS tool at the Implementation Science Exchange at my former institution, UNC. It's on the CTSI's website. And it is, it's online and it's a pretty usable tool. And basically what it does is walks you through these domains of the TCAS. Basically assessing really critically how familiar, usable, applicable, and testable the TMFs that you have taken under consideration might be. And so you don't have, the tool walks you through assessing kind of which of these domains and which constructs within these domains are relevant to you and your project and your study team. And to really critically evaluate why you've chosen the theory, model, or framework that you've chosen. But speaking practically, given that this is an imperfect science, what can you do to select a theory, model, or framework? Here's my suggestion. First of all, go back to slide 11 and just think about like what stage of your implementation research you're in. Are you identifying determinants, potential determinants? If so, you probably want like a determinant framework. If you're looking to evaluate how implementation went, you probably want an evaluation framework. If you're looking to kind of guide the implementation process, a process framework. Also consider your goal. Pear walks through this really nicely, and I think this is a nice way to think about it as well. And, you can kind of use these tools in conjunction. I think that could be useful. I love Google. I often will type in, relationship between implementation climate and implementation, determinants of middle managers' commitment to implementation. I'm definitely not above that, and I hope you won't be either, because, I sincerely believe there's nothing new under the sun, and it can be really great to kind of figure out what other investigators have used to frame their questions, and it can help to kind of accumulate knowledge within the field. Also, just phone a friend, ask somebody, here's the thing that I'm thinking about. Can you help me think about how to frame it conceptually and get a few opinions? So here's where I promised I would talk about applying implementation theories, models, and frameworks. I give a huge amount of credit to Alexis Kirk, who is a former student of mine. She's now at Cornerstone doing implementation practice. But what she and several VA colleagues and I found in a systematic review of the use of the CFR is that a whole lot of the use of the CFR is very superficial. We used CFR in this study, and that was about it as far as talking through the use of that particular framework. And there's also, I think Russ Glasgow and his colleagues did a similar kind of review of the use of REAIM and found very similar superficial use of REAIM. I think this is often the case. Lou Atkins and her colleagues did a really lovely paper guiding people through the use of the theoretical domains framework. I think that their work has generalizable features beyond the theoretical domains framework application. So definitely recommend giving it a look. But Alexis, our colleague Emily Haynes, and many others continue to work on thinking about how we can provide guidance on applying theories, models, and frameworks. So I have a colleague, I think at the National Cancer Institute, who's a program officer, who got an AIMS page that said, you know, it had blah, 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 all the research questions, and it literally had in brackets, insert theory here. No, don't do that. That's a shame. What a waste of a good theory when it could really work for you. So I'm hopefully going to talk through in these last few minutes how you can make theory work for you. So, you know, I talked about, first of all, just explicitly justify the use of your theory, model, or framework. Like, why is this a good, are there estimates of like, 70 to 120 implementation theories, models, and frameworks? Like, why the one that you chose, or the 2 or the 3 or whatever? Like, just justify it. But next, you can really integrate that theory, model, or framework, or multiple, throughout your project, and should. So I'm going to walk through each of the ways, each of the stages of your work that you can integrate a theory, model, or framework. So this one is probably not super applicable to most of us, but I just wanted, to demonstrate that some people do motivate their research question with a theory, model, or framework. Probably usually a theory, like in this case, Doug Holey and his colleagues were motivated to look at the birth and death of health maintenance organizations based on population ecology theory. I have also, I know that I've known people who are just really interested in implementation climate. And so they conceptually are very interested in that. And so they do an empirical study to dig deep into that concept and might use the theory of implementation climate, which Brian Weiner developed. So it does happen, not super common, I don't think. This is a busy slide that I regret, but I'll just say that using theories, models, and frameworks to guide study design is critical, right? So if you're using an evaluation framework, you are by definition looking retrospectively. This is fun. If you're using a process model, you are by definition looking prospectively. Determinant frameworks can go either direction, really. You can be thinking retrospectively, which oftentimes like CFR and TDF studies are asking providers, why did you or did you not use this intervention? But people like Julia Moore are thinking about, how do we use these determinant frameworks prospectively? Can we think about anticipating the way in which, for example, leadership might influence the implementation of a particular intervention? This is where I get really excited because it's so practical. And I know that so often people come to me thinking about theories as like ivory tower nonsense. But they can be so practical. And here's, I think, a place that really resonates with people. So I get a lot of interview guides, for example, that are pinned really to nothing. People will say, I'm using the theoretical domains framework in this study, and then I get the interview guide, and it really has nothing to do with the theoretical domains framework. There's no relationship between the questions being asked in the interview guide or the survey and the framework that the person has chosen. It drives me bonkers. So I'm really excited about the prospect of helping people. You can email me and I will give you a table that is this. I will send it to you. In fact, you know what? It's actually in a paper. It's an additional file in a paper that I wrote where I literally just pin each question to a construct. It's such a good exercise. It makes it a really efficient interview for the interview participant because you're really being specific about what you're asking them because it's related to the theory, model, or framework that you've put into use. And it also makes sure that you are getting out of the interview the data that you want. God forbid you go through all those interviews and realize you didn't address a construct in the theory, model, or framework that you've chosen. Brian Weiner said to me when I was conducting a survey study as a postdoc, when I presented a survey, and he encouraged me to go through this process of mapping the construct onto the survey item. He said, measure twice, cut once, right? You want to make sure that you really have everything in that survey or that interview guide that you're going to need for the analyses that you've proposed to conduct. And literally just making sure that everything you think you're assessing is represented in the data collection tool that you're using is a really great way to do that. I also advocate for the use of theories, models, and frameworks to guide data analysis. So I'm going to go through this in just a moment. So you're not meant to read the words here. This is just an interview transcript in a software, qualitative data analysis software called MaxQDA. And alongside here, you will see codes. And these codes are actually ERIC strategies. That was kind of the framework we were using to think about determinants of survivorship care planning, I think was this study. And so literally the constructs within the framework were codes. We're using them to code the qualitative data. So that's how you can use a theory, model, or framework to guide data analysis. You will see in my studies theoretical domains framework and consolidated framework constructs as codes in my qualitative analysis. So for the quantitative application of theories, models, and frameworks, we should be thinking about, this should guide which variables we want to include in the analysis so we don't end up with a kitchen sink model. We have a really clear idea of what variables are relevant. And when you have a theory as opposed to a model or a framework, you can use the theory, model, or framework to suggest potential mediating or moderating relationships among the variables, which you can model statistically. So that's a way that a theory, model, or framework can be used to guide data analysis. So I would also advocate for the use of theories, models, and frameworks to guide the interpretation of findings. So I'm consulting on a project in which my colleagues and I are looking at determinants of precision medicine use in cancer. And we are using the theoretical domains framework, and there are a bunch of codes that fall into the environmental context and resources domain of the theoretical domains framework. Things like reimbursement, and I can't think of what else. But what I recommended was that they think about this bucket, this domain of environmental context as like a policy domain. What does it mean that we're finding so many issues in the policy environment? What does that mean about the implementation of precision medicine? It can help us think about and organize our thinking around the results, so that we don't just end up with kind of loosely related constructs that have emerged as potential determinants. We can think about them conceptually together. And implications, we all write our little implications section in our papers or in grant proposals. We talk about kind of what we are promising the funding agency if we are funded to do the research. We can glean from the theory, model, or framework some implications. So I gave that example of kind of this environmental context domain comprising a lot of the results that we're finding in this precision medicine study. And so what I've advocated for is framing this as policy recommendations, right? If we want people to use precision medicine, there's some policy work that needs to be done. Reimbursement has to change. Guidelines might have to change, for example. Accreditation standards might have to change. Those all kind of speak to recommendations for policy. And thinking more in terms of, the CFER's inner setting, if leadership is identified as an area where there's a lot of traction in terms of the results, we can make recommendations about what needs to happen in practice. What do we need to do to get leadership behind the implementation of survivorship care plans, for example? How can we affect change? These are the changes that we think need to happen in practice. And theories, models, and frameworks can help us to organize our thinking around implications. I'll say regarding theories, models, and frameworks and the implications, I often advocate for, I always advocate for critical or criticism of the theory, model, or framework. What does it mean, for example, if our results conflict with the results of other studies that have used the theory, model, or framework, or other studies of the implementation of that particular intervention? Maybe we need to revise the theory, model, or framework. Maybe our results suggest kind of a unique spin on what we've already thought to be a truth with respect to, determinants of implementation. So I did a little bit of this with my work on middle managers, thinking about, maybe there's a recursive relationship between implementation climate and middle managers' commitment to implementation, whereas before we kind of thought it was a one-way relationship where middle managers contribute to implementation climate. But what evidence suggests is that actually there is this kind of dynamic relationship between the two. That's okay. Theories, models, and frameworks are meant to be dynamic. So I'll close by saying, I love this quote from George Box. He says, "All theories are wrong. Some are useful. These are just tools. At the end of the day, don't put them on a pedestal. They are not gospel. They're tools. And use them well." Like I said before, a theory, model, or framework should not be an albatross around your neck. It shouldn't be a burden to you. It should really give your research wings. And I will just acknowledge my colleagues, Cheyenne Waggy, Alex Peluso, Per Nielsen, and Alexis Kirk. And I'm really excited to hear any questions or comments you have.
Great, thank you. We do have several pending questions here, so I'm just going to jump in and we're going to work through some of these here.
Great.
Okay, the first question I have here, I am still a bit confused about what a strategy is. Can you give an example of a strategy for identifying determinants?
Oh, I thought at the beginning that it was just a question about strategies, like implementation strategies, but it sounds like the question is actually about strategies for identifying determinants. So I'll just kind of address the latter part in hopes that will address it. So I would just say the approach, I'll use the word approach, to identifying determinants can be very practically like interviews, using a theory, model, or framework to develop an interview guide or a survey to understand kind of what is influencing the implementation of a particular intervention. So asking providers, for example, about their motivation to use the intervention or the implementation climate around the use of that particular intervention. I think I'll leave it there without any kind of additional clarification, but happy to answer, elaborate more if if that would be helpful.
Okay, we'll see if we get a follow-up on that.
Yes.
Okay. The next question here, and I apologize to everyone. I say this often, I am not a subject expert, so sometimes when abbreviations come in, I completely butcher them. I apologize, but I'm trying my best here. Do we need to also study the contexts in which the initial interventions are developed for some clues as to the reliability of applying interventions, as well as pairing them with appropriate implementation strategy in different contexts?
I love whoever asked this question. Yes, a million times yes. I am a big advocate of understanding context. I do not believe that it is reasonable to study interventions as though they are not embedded in contexts. In fact, I think that there is complex interaction among the intervention, the context in which it was developed, and the context in which it is to be implemented, and the strategies that are being applied. Jeff Curran has this lovely paper about the thing, I think it's called Implementation Science Made Too Simple. We like to think about these things as discrete, but they're not. They really do have interactive relationships. So the context in which you're implementing something inevitably influences its effectiveness or its implementation. The strategies too, and starting to kind of tease those things apart is incredibly complicated, which is why I advocate for methods like ethnography and user-centered design to start to harmonize those things. Emily Haynes is doing some really exciting work on this topic. So yes, love the question.
Great, thank you. Okay, the next question here. I've noticed that use of the term theory can be split into theory with a big T and theory with a small t. How have you learned to help people distinguish between theories, frameworks, and models? For instance, I just had a discussion with a colleague about CIFAR. They called it a theory, capital T, and I called it a framework. What are your thoughts?
My thoughts are that you're right and your colleague is wrong. So a theory is has a very specific definition, which is that it proposes relationships among constructs. CIFAR is comprised of some theories and some evidence. It is a conceptual framework. It is not a theoretical framework. A theoretical framework is comprised of theories alone. So the theoretical domains framework is comprised of 33 psychological theories. It is a theoretical framework. The implications are that you can't use the CIFAR to propose relationships. You can say that a particular construct is thought to influence implementation, but you can't, the CIFAR does not tell us anything about why or how that construct is thought to influence implementation. Moreover, it can't tell us how that construct relates, if at all, to other constructs within the CIFAR. Aside from that, which is a little bit of a soapbox moment, aside from that, I don't get too precious about, theories, models, and frameworks. If I'm big on combining them, obviously, again, in the vein of these are tools for our use. And I think little t theory can be useful insofar as you just make it explicit. I don't want people to shy away from making their thoughts about the way the world works or their assumptions about the way the world works by saying you have to use an established theory, model, or framework. It's okay not to. The problem is that, again, there's nothing new under the sun. There's probably some established theory, model, or framework out there that says what you're trying to say or something close to it. And if we can stand on the shoulders of giants and contribute to the accumulation of evidence, why wouldn't we? The danger in using a little t theory, which is just kind of like an unspecified Trish Greenhosh, I don't know if I can attribute this to her, I think I can, said theories are like toothbrushes. Everyone has their own and nobody wants to use anybody else's, which I just love, and it's so true. But the problem with that then is that we're not really congealing evidence as a field, and we won't come up with generalizable knowledge. So.
Okay, great. Thank you. The next question here. How do you predetermine challenges to implementation when a new or novel program is being implemented?
Yeah, very cool. So this is where kind of accumulating evidence is really useful. And I think that the more data that we have using common frameworks, the more we can start to predict this. So I think I saw Edward Niek's name come up. He's a pioneer in the use of configurational methods and in implementation science. And I think that, QCA and coincidence analysis are really useful ways that we can start to pool knowledge from studies of multiple interventions in multiple contexts using multiple strategies to identify common features. And we can look at co-occurrences of features of interventions and contexts and strategies and other things to start to anticipate when implementation goes best. So it might be, we all know that what works in a small rural community health clinic is not probably going to work in a large urban comprehensive cancer center. And then you throw in the variable of different features of interventions. But if we can start to generalize a little bit across features of contexts, strategies, and interventions, we can start to say, when you have, for example, a management or administrative innovation or intervention in large urban cancer programs or what have you, here are the strategies that we find are most useful. You can also say the same. As we pool this knowledge, we'll be able to predict. That's my hope anyway.
Great, thank you. And I'm going to try to sneak in one more question before we close the session. I know we do have a lot of pending questions. I'm going to get them sent over to our presenter after the session. We're going to try to get through one more here. If you are going through all three stages in one proposal, identifying determinants, guiding implementation process, and evaluating implementation, what is the best way to talk about strategies in a way that is specific but allows for an iterative process?
Ooh. Next question. No, I'm just kidding. I don't know if I can answer that. I mean, I don't know if the question is referring to like implementation strategies, or maybe it's referring to theories. I mean, maybe I'll just be a politician for a minute and I'll answer the question I want to answer because I'm not sure exactly what the question is asking. And I don't think there's time for clarification, but I think what I'll answer is about kind of people worry about needing multiple theories, models, and frameworks. That's fine. That's totally fine. And I'm very pragmatic about putting the theories, models, and frameworks in the different parts of the proposal where it makes the most sense. You might have a conceptual model section in your grant where you kind of talk broadly about the way you think the intervention works or whatever. And then in the methods section, you point to a particular like process model that is going to guide the implementation of your thing. And then you also talk in another aim about the application of re-aim, for example, to evaluate the implementation of the thing, which is totally reasonable. You can do that. I think I probably didn't answer the question, but feel free to email me for clarification with a clarification so that I can better answer it offline.
Perfect. Sounds great. And with that, we're at the top of the hour, so we're going to close things out here. Sarah, I just wanted to ask if you wanted to make any closing remarks before we close today's session out.
No, just thank everybody for hanging out. I appreciate it.
And Christine, do you have any closing remarks you'd like to make today?
Yeah, just briefly. Thank you, Heidi, and thank you so much, Dr. Birkin. This was a fabulous presentation on things we get questions on so often. We had a great turnout. I am sure that people will go ahead and view the archive of this. And so thank you so much for all the work that you put in preparing this. As you said so perfectly, sometimes people see these models, theories, and frameworks as ivory tower nonsense, and we want to get past that and show their utility when they're not used in a superficial way and in a way that they can be useful to implement clinical practice. And just last real quick, so if people are interested in seeing more content like this, please join the IRG. You can just email irg@va.gov. Thanks so much, everyone, for joining.